Have you ever woken up from a daytime nap feeling worse than before you closed your eyes? If you're between 65 and 80 years old, this isn't just an inconvenience. It could be a warning sign your body is trying to send you. Right now, millions of seniors are making simple mistakes during their afternoon rest that slowly damage their heart, reduce oxygen to their brain, and increase their risk of serious health complications. And the scariest part? Most people have no idea they're doing it. In this video, I'm going to walk you through 5 dangerous daytime sleep habits that seem harmless, but can quietly put your health at risk. One of them, habit number 3, is something almost everyone does without a second thought. But once you understand what it does to your circulation and breathing, you'll never look at napping the same way again. So if you or someone you love is in this age group, stay with me until the end. Because what you're about to learn could protect not just your sleep quality, but your heart, your brain, and possibly even your life. Let's dive in. Habit 1. Napping immediately after eating. This is one of the most common and most dangerous habits among older adults. You finish lunch, feel that wave of tiredness wash over you, and think, I'll just rest my eyes for a few minutes. It feels natural. It feels harmless. But what's happening inside your body during that time is anything but peaceful. When you eat, especially a large or heavy meal, your digestive system demands a massive amount of blood flow. Your stomach, intestines, and liver all need extra oxygen and nutrients to break down the food. So your body redirects blood away from other areas, including your brain and muscles, to focus on digestion. Now, if you lie down right after eating, you're forcing your body into a confusing situation. It doesn't know whether to prioritize digestion or support your brain and heart during rest. This conflict creates a dangerous imbalance. Blood pressure drops. Oxygen delivery to the brain slows down, and your heart has to work harder to compensate. For someone in their 30s or 40s, this might just cause a little grogginess. But for someone over 65, especially if you already have mild circulation issues, high blood pressure, or diabetes, this can trigger dizziness, confusion, chest tightness, or even fainting when you wake up. I once knew a gentleman named Robert. He was 71 years old and had a habit of eating a big lunch and then immediately lying down on his couch for what he called a power nap. But every single time he woke up, he felt disoriented. His vision was blurry, his hands felt cold, and sometimes he'd get a sharp pain in his chest that would fade after a few minutes. He brushed it off as indigestion. But when he finally mentioned it to his doctor during a routine checkup, the doctor explained what was really happening. His blood pressure was dropping too quickly after meals, and lying down made it worse. His brain wasn't getting enough oxygen during those naps, and his heart was under stress trying to fix the problem. The solution was simple. Robert started waiting at least 45 minutes to an hour after eating before lying down. He'd take a short walk around the house, sit upright and read, or do light stretching. And just like that, the symptoms stopped. His naps became refreshing instead of frightening. The lesson here is clear. Give your body time to digest before you rest. Let your circulation stabilize. Let your stomach do its job. Then, when you do lie down, your body will be ready to rest properly, not fight to stay balanced. Now let's talk about another habit that catches people completely off guard. Habit 2. Napping in a room that's too cold. This one surprises a lot of people. After all, isn't it nice to sleep in a cool room? Doesn't it help you fall asleep faster? For younger people, yes. But for older adults, especially those over 65, a cold environment during a nap can be genuinely dangerous. As we age, our body's ability to regulate temperature weakens. The systems that once kept us warm without effort now struggle to keep up. And during sleep, your body temperature naturally drops a little. That's normal. But if the room is already cold, your body may drop below a safe range without you even realizing it. Cold air causes your blood vessels to constrict. That means less blood flows to your heart, your brain, and your extremities. For someone with already reduced circulation, this can be a serious problem. Your heart has to pump harder. Your brain gets less oxygen. And when you wake up, you might feel confused, shaky, or short of breath. Let me tell you about a woman named Margaret. She was 76 and loved napping in her living room by the window. She enjoyed the fresh air and the coolness it brought, especially in the spring and fall. But one afternoon she woke up unable to move her fingers. Her lips were pale, her heartbeat was racing. She felt panic, but didn't understand why. Her daughter called an ambulance, and at the hospital, the doctors discovered that Margaret's core body temperature had dropped dangerously low. Her body had gone into a mild state of shock trying to warm itself back up, all because her nap environment was just a few degrees too cold for too long. The doctors told her that for someone her age, even a small drop in temperature during rest can put significant strain on the cardiovascular system. They advised her to keep the room warm, avoid drafts, and use a light blanket even if she didn't feel cold at first. Margaret made those changes, and she never had that experience again. But it was a wake-up call. Literally. If you feel even slightly chilly during a nap, don't ignore it. Your body is working overtime to keep you warm, and that effort is stealing energy from your heart and brain. Keep your nap environment stable, warm, and draft-free. Comfort isn't just about feeling good, it's about staying safe. Before we continue, if you're finding this information helpful, please leave a comment below and let me know. And if you haven't subscribed yet, hit that subscribe button and turn on notifications so you don't miss future videos. Your support means the world and helps us keep creating content that truly matters. Now, let's move on to habit number 3. This is the one that almost everyone does, and it's more dangerous than you might think. Habit 3. Sleeping in a reclined position instead of lying flat. This is a big one, and I can already hear some of you saying, "But I always nap in my recliner, it's comfortable, what's the harm?" Here's the harm. When you sleep sitting up or in a reclined position, your airway becomes partially restricted. Your neck bends forward slightly. Your chin moves closer to your chest, and that small change in angle reduces the amount of air that flows into your lungs. You might not notice it at first. You fall asleep. You rest for 20 or 30 minutes. But the entire time your body is getting less oxygen than it needs. Your breathing becomes shallow. The deeper parts of your lungs, the parts that do the heavy lifting, don't expand fully, and over time carbon dioxide starts to build up in your bloodstream. For older adults, this is especially dangerous. Our lung capacity decreases with age. The tissues lose elasticity. The muscles that support breathing weaken. So when you nap in a position that restricts airflow, you're making an already difficult job even harder. Some people wake up gasping for air. Others wake up with a pounding heart, drenched in sweat, or feeling like they just ran a marathon. They think it was a bad dream. But it wasn't. It was oxygen deprivation. There was a man named Thomas, 73 years old, who napped in his recliner every single day after lunch. He said it helped him relax. But after a few months, he started waking up with severe headaches. He felt exhausted even after sleeping a full night. And his wife noticed that sometimes while he napped, he would stop breathing for a few seconds at a time. She convinced him to see a doctor, and during a test, they monitored his oxygen levels while he napped in his usual position. The results were alarming. His oxygen saturation dropped into a dangerous range. His heart rate became irregular, and his brain wasn't getting the oxygen it needed to function properly. The doctor's advice was simple. Stop napping upright. Lie flat. Let your lungs open fully. Give your body the oxygen it's designed to use. Thomas started napping on his bed, lying flat with a supportive pillow. Within 2 weeks, his headaches disappeared. His energy returned, and his wife no longer heard those terrifying pauses in his breathing. If you've been napping in a chair, a recliner, or propped up on a couch, I'm asking you to reconsider. Your body needs full, deep breaths to stay healthy, and the only way to guarantee that is to lie flat. Let your chest expand, and let your lungs do their job. Now let's talk about another habit that seems innocent but quietly disrupts your entire system. Habit 4. Drinking coffee or tea right before a nap. This one might surprise you. After all, coffee and tea are part of daily life for millions of people. A warm cup after lunch feels comforting. It's a ritual, a moment of peace. But if you're over 65 and you're drinking caffeine before a nap, you're setting yourself up for a dangerous cycle. Here's why. As we age, our bodies process caffeine much more slowly. What used to leave your system in 3 or 4 hours can now linger for 6, 8, even 10 hours. So even if you manage to fall asleep after drinking coffee, your body never fully rests. Caffeine keeps your nervous system on alert. It raises your heart rate, it tightens your blood vessels, it prevents your brain from entering the deep, restorative stages of sleep. So you might close your eyes for 30 minutes, but your body is still running on high alert the entire time. When you wake up, you feel worse. You're irritable. You have a headache. Your heart feels like it's beating too fast, and you're more tired than before you lay down. That's not rest. That's stress disguised as sleep. I knew a woman named Diane, 68 years old, who loved her afternoon tea. She'd have a cup right after lunch, then lie down for a quick nap. But she always woke up feeling anxious. Her hands would shake, her chest felt tight, and she couldn't understand why. Her doctor asked her about her routine, and when she mentioned the tea, he immediately knew the problem. He explained that the caffeine was keeping her heart rate elevated and preventing her body from truly resting. He suggested she switch to herbal tea, or simply wait until after her nap to have her regular tea. Diane made the change, and within days she noticed a difference. Her naps became calming, she woke up refreshed, and the anxiety she'd been feeling disappeared completely. If you want your nap to actually restore your energy, skip the caffeine beforehand. Let your body rest without interference. Your heart and brain will thank you. Now let's talk about the final habit. This one is subtle, but it has a powerful impact on your overall health. Habit 5. Napping for too long without setting a limit. There's a sweet spot when it comes to napping, especially for older adults, and that sweet spot is somewhere between 20 and 40 minutes. Any shorter, and you don't get much benefit. Any longer, and you start to enter deeper stages of sleep that leave you groggy, confused, and sometimes even more tired than before. But here's the bigger problem. Long naps, especially those lasting more than an hour, can disrupt your nighttime sleep. They throw off your circadian rhythm. They confuse your body's internal clock. And over time, this can lead to insomnia, depression, and increased risk of heart disease. Research has shown that people over 65 who nap for more than 90 minutes during the day have a significantly higher risk of cardiovascular problems. Why? Because long daytime sleep often means poor nighttime sleep, and poor nighttime sleep means your body never gets the deep, uninterrupted rest it needs to repair your heart, clean out toxins from your brain, and regulate your hormones. There was a man named Edward, 77 years old, who would nap for 2 or 3 hours every afternoon. He thought it was helping him, but at night he couldn't sleep. He'd lie awake for hours, staring at the ceiling, feeling restless and frustrated. His doctor explained that his long naps were stealing sleep from the night. His body didn't know when it was supposed to be awake and when it was supposed to rest, so it was constantly confused, constantly out of sync. Edward started setting an alarm for 30 minutes. At first, it was hard. He wanted to keep sleeping, but after a week, he noticed something amazing. He started sleeping through the night. He woke up feeling rested, and his mood improved dramatically. If you're napping during the day, set a timer. Keep it short. Keep it intentional, and protect your nighttime sleep like your life depends on it, because in many ways, it does. So there you have it. 5 dangerous daytime sleep habits that can quietly damage your heart and brain if you're between 65 and 80 years old. To recap, don't nap right after eating. Give your body time to digest. Don't nap in a cold room. Keep your environment warm and stable. Don't nap in a reclined position. Lie flat and let your lungs work properly. Don't drink caffeine before a nap. Let your body truly rest. Don't nap for too long. Keep it short and protect your nighttime sleep. These might seem like small changes, but they can have a massive impact on your overall health. Your heart, your brain, and your energy levels all depend on how well you rest. And rest isn't just about closing your eyes. It's about giving your body the conditions it needs to heal, recharge, and stay strong. If you found this video helpful, please give it a thumbs up, share it with someone who needs to hear this, and subscribe to the channel for more health tips that can truly change your life. Take care of yourself. You deserve to feel good, sleep well, and live fully. I'll see you in the next video.